I can't imagine a better career than having the opportunity to take care of people. People come to me when they're very vulnerable. You know, they have a bad disease, they have heart disease. It's my job to make them feel comfortable, really, so that their lives can be the kind of quality of life that they would like. It's what I get up for every day. Being a heart surgeon, the type of patients that I see are those with advanced heart disease. Usually patients who have coronary artery disease, patients who have valvular heart disease, or patients who have aortic aneurysms. The good thing about coming to see me here at university hospitals is, first of all, our approach is really personalized. And being at University Hospital in an incredible academic medical center, I have the resources of hundreds of colleagues. And so if there are things that I need help with, I can reach out to my colleagues. We work together to come up with the best treatment plan that is really individualized for that patient and the disease that they have. You know, I do heart surgery. These are big operations. And that privilege of being able to help someone and the privilege of being able to operate on someone and really change their lives. I tell my team every day that the 4 hours that this patient is going to spend with us in the operating room are the most important 4 hours in the rest of their lives. And so the next day, when they appreciate that and they say thank you, it just brings joy to my heart.